shot in school. My life changed after the Sandy Hook shooting, and I saw what happened just on the television. As a kid in Orlando, it was before a jazz band concert. But coming up here and being a part of that vigil at such a young age, meeting people my age who had lost loved ones due to senseless gun violence, changed my life forever. My own district and my own community 3 years later would experience this armed bigotry and this armed hate at Pulse nightclub, where we lost 49 angels due to armed bigotry and armed hate. And just a few hours south of me, in Parkland, Florida, we saw one of the most gruesome and horrible acts of gun violence at Marjorie Stoneman Douglas High School, where kids died in pools of their own blood when they didn't have to in this country. For years, we have known that gun violence was more than just an epidemic. It was a public health crisis and is a public health crisis that claims too many lives. But yesterday, this movement received, and this country received, a huge win. A major landmark announcement from the U.S. Surgeon General as he declared gun violence as a public health crisis. This advisory exposes what we've already known to be true: the devastating reality of gun violence on the health and well-being of our communities and our people. This declaration is a significant step forward in the fight to protect our communities and our children, because it's a holistic thing. It looks at ending gun violence in many different ways. It's an advisory that answers the calls that members like Representative Barbara Lee, Representative Thompson, myself, many members of Congress, advocates, organizers, survivors, and families have been pushing for, not for years, but for decades. Because we believe that gun violence has never been a political Democrat versus Republican thing and shouldn't be, it's time to see the issue for what it is: a health issue. When gun violence is the leading cause of death for children, what I like to tell parents: if God forbid you lost your child before the age of 18 tomorrow, in this country, the most likely reason would be because of a bullet. And I don't know about you, but I believe that's unacceptable. This week, we're also celebrating the 2-year anniversary of the Bipartisan Safer Communities Act. Let me tell y'all, the actions we've seen over the last few years from this administration, and even from Congress, are groundbreaking. I've been a part of the gun violence prevention movement for over a decade, and I can tell you right now that for the first time, the gun violence prevention movement is stronger than the NRA, is stronger than the gun lobby. And some folks might ask, well, why haven't we got everything we want? But if you look in the history of this country, what will help us win isn't just getting power for a year or two, it's sustained power. That's how we continue to get these wins. This report shows that gun violence is an issue that's going to be fixed in many different ways, and I like to focus on 3. 1, regulation to ensure that guns don't get in the wrong hands. 2, supporting community violence intervention and community-based programs so we can stop this violence before it even happens. And number 3, which is one of the most important, creating a society where people don't feel the need to use a gun to solve their problems in the first place. As this administration and as we work in Congress and advocates and organizers work to tackle all 3, we will end gun violence. One more point on why this is such a significant development. When the Surgeon General puts out a report and advisory like this, declaring something a public health crisis, when we look in history of this country, similar reports and advisories were given before there was landmark action on seatbelts. Similar things were put out before there was actions on smoking. And so I believe that this is a great signal that there's going to be even more actions to come so we can save the lives of our people due to senseless gun violence. And without further ado, I'm going to pass it on because it's hot. It's not as hot as it is in Florida, but it's pretty hot. I'm going to pass it on to someone who's been an advocate and a champion for this specific thing for a long time. I'm so proud to be able to work and serve alongside of her. Please give it up for the amazing, the illustrious Congresswoman, Barbara Lee.
Wow. Well, first of all, thank you so much. Thank you, Congressman Frost, for that very spirited and warm introduction. But thank you for your leadership, because since you have been here in Congress, the tide has turned. And it's important that you all recognize that having somebody come to Congress, such as Congressman Frost, with the experiences that he's had, with the commitment that he's had, and with his brilliance and his passion, the needle is moving in ways that it never moved before. So thank you so much. And thank all of you for being here, because we couldn't get this far if it weren't for you. And we're going to get this done. We're going to end gun violence in America. And this is a major step in that direction, because it is an epidemic. And as Congressman Frost said, throughout history, Surgeon General's reports, they've fundamentally changed the nation's perspective on issues like smoking, HIV and AIDS, and drunk driving. So this week's advisory adding gun violence to this list makes a major step forward in the movement to fight it. Let me just say, give you one story from my district, which I'll always remember. As you know, I come from Oakland, California. You know, we have, just like every community, so too many guns on the streets. And I had a forum a couple of years ago, and there was a young brother who came to my forum to talk about why we needed to get the guns off of the streets of America, and then, of course, of Oakland. And he was very brave in coming to my forum. He talked about it, his experiences, what was taking place. 2 weeks later, he was shot and killed. And, you know, this touches us in very personal ways, and to see so many children now as it relates to the primary cause of death of young people, gun violence, in America, the richest and most powerful country in the world, it's a shame and disgrace. And so when I started working on this way back when, I invited Senator Padilla, and we hosted a roundtable with community leaders about the epidemic of gun violence in our community. And from that meeting, we worked tirelessly to sound the alarm to the Biden administration to declare gun violence a public health emergency. And we were on a mission to reframe the gun control and community violence conversation around public health. Gun violence has impacted far too many communities across this nation, from mass shootings at schools to daily crime in vulnerable neighborhoods. And it's not just a political or law enforcement problem, it's a public health crisis, and it deserves to be treated as such. My own community, again, in Oakland, we're suffering from 2 very recent tragic bouts of violence. It happens much too often. In fact, guns killed 44,000 Americans and severely injure hundreds of thousands more each year. It's the leading cause of death for children in the United States, and it disproportionately impacts communities of color. Just last year, Axios poll found that access to guns was America's #1 public health concern. Mass shootings that have continued to devastate our schools, our public places, and our communities, our places of worship, they're clear examples of why we need a public health approach to this issue. Americans are constantly telling us that they want to see change on this issue because of how it's impacted their quality of life. So the Surgeon General's advisory builds on decades of work done by grassroots activists, community organizations, public health experts, and community and public officials. Now we have this moment in Congress to create a renewed sense of urgency around this issue. It's long past time for the federal government to enact universal background checks, which is one of the recommendations, close purchasing loopholes, and require the safe storage of firearms. Just basics. And so we need Congress to ban assault weapons, to restrict high-capacity magazines, and to take weapons of war, and that's what these weapons are, weapons of war, off of the street. So inaction is not an option. When lives are on the line, this is about saving lives. So together, I know that our movement will grow only stronger each and every day. It's grown stronger since Congressman Frost has been here in Congress. So I just want to thank all of you for your leadership and staying the course. And I want to thank the media for coming, because this is a big deal. These recommendations, which the Surgeon General have put forward, we need to thank him for it, thank the Biden-Harris administration, and also Secretary Becerra. We've had many discussions with the Secretary. And so they are to be lifted up and commended, and just know this is just the beginning of getting the guns off the streets of America and truly saving lives. Thank you all again.
Next up, we're going to have Dr. Joseph Sachan from Brady.
Thanks so much. Well, good afternoon. It's great to be here. I want to thank Congressman Frost and Representative Lee and all of my colleagues that are here with us today. Look, My name is Joe Sachan. I'm a trauma surgeon at Johns Hopkins, but I also come to this conversation as a survivor after nearly being killed at the age of 17 when I was shot in the throat. And that really inspired me to go into medicine and to become a trauma surgeon. And I'm here in that capacity and also as a chief medical officer at Brady. Look, today is a historic day. Often when we're standing up here in front of the media, it's after another mass shooting or some terrible event. But we are standing up here celebrating a historic step and another step in the right direction. The Surgeon General's advisory declaring gun violence a public health crisis is historic for a number of reasons. And it underscores, right, what so many of us, both within the healthcare profession as well as the gun violence prevention movement, have been calling on for years. For over a decade, we have been talking about this issue in terms of a public health crisis. We're trying to change the narrative and move it from people trying to pigeonhole it as a criminal justice issue and make people understand that it is a health issue. And that's what happened yesterday. And that critical moment allows for a number of things. One, for us to acknowledge the severity of this issue, right? That gun violence impacts the health and safety of Americans. Similar to how we have acknowledged other issues like smoking and drug use and infectious diseases. It also allows us to focus on the rigorous, data-driven approach that we all want in order to provide solutions that allows us to make communities safer. This report allows us to also empower policymakers, right, and push them to develop programs and policies that will impact not just cities but the entire country. And that's why people like Congressman Frost, they're here every day trying to do that hard work. The last, probably and most important thing is it raises the public awareness, right? For far too long, we talk about this in terms of numbers and statistics. And what I can tell you as someone who operates in East Baltimore and takes care of patients, these are not just numbers and statistics. These are moms and dads, their brothers and sisters, and there is nothing worse than having to explain to a mother that their child that left that morning is never coming home again. And that's why despite, how good we may think we are as clinicians, as trauma centers, as health systems, the best medical treatment is prevention. And that's why we're doing the hard work beyond the bedside. It's why we're pushing beyond the operating room to make people understand that we have to prevent these injuries from happening because this is a public health problem. And there is no one solution. It requires a multifaceted approach that cuts across all different sectors: healthcare, education, law enforcement, policymakers, and so forth. So I just want to end by saying this is another step in the right direction. We've already heard about how the Biden administration has been pounding the pavement day in and day out with passage of the Bipartisan Safer Communities Act, the starting of the White House Office for Gun Violence Prevention, different executive actions. This is yet another aspect that will allow us to ensure that we're ending gun violence and reducing the number of people that are being injured and killed. If you don't think it matters, I would just ask you, come spend a day with me and you'll understand why these interventions are so critical and why all of us need to step off the sidelines of history and be part of the solution. And that includes in November at the ballot box. Thank you so much.
Next up, we're going to have Dr. Angela Hawkins.
Good afternoon. My name is Dr. Angela Hawkins. I'm chair of the Oklahoma section of the American College of Obstetricians and Gynecologists. Thank you, Congressman Frost and Congresswoman Lee, for inviting us to speak with you all today. The Surgeon General's advisory declares what we as OBGYNs have long understood. Gun violence is a public health crisis. We care for patient populations that disproportionately experience intimate partner violence, and the presence of firearms is a key risk factor for intimate partner homicide. More than 50% of homicides perpetrated by an intimate partner involve a gun, and nearly 60% of mass shootings have a domestic violence component. The latest research has shown that homicide is the leading cause of injury-related deaths for pregnant and postpartum individuals. Most of these homicides are carried out with firearms. And for the second time, mental health conditions, which include deaths by suicide, were reported as the leading cause of maternal mortality. And we know from the Surgeon General's advisory that more than half of all suicide deaths are carried out with a firearm. As co-chair of Oklahoma's Maternal Mortality Review Committee, I recently reviewed a maternal death by firearm associated with domestic violence. In another example, one of our local hospital employees was shot 8 times in the parking lot by a former intimate partner. And just yesterday, 3 women in Florida were killed by gun violence in a family dispute, leaving their children and families devastated. These actions have impacts on families for generations to come. The epidemic must end. The discussions we have in the exam room are important for the safety of our patients, but that alone is not enough to save our patients. We need continued investments in rigorous prevention research that will inform strategies to avoid preventable injuries and death. We need Congress to take action and prioritize an evidence-based public health approach to gun violence that emphasizes prevention, education, and safety. ACOG applauds Surgeon General Murthy and the leaders here today for making this issue a priority. The lives of our patients, our colleagues, and our communities depend on it. Thank you.
From CAP, we have Arnita Holloman from the Center for American Progress.
Thank you, Congressman Frost, Representative Lee. Thank you for your leadership on this issue. I recall standing with you maybe a year or so ago when you were calling for the establishment of the Office of Gun Violence Prevention, and we've seen that happen among other things, including the call for this advisory. So thank you so much for your leadership. I stand here as a survivor, as someone who has lost family members and loved ones to gun violence, and as someone who has worked locally addressing the issue, to work to prevent gun violence, to stop cycles of violence. And we can talk about numbers all day, and that matters, because with over 100 people a day being killed as a result of gun violence, that is an issue that is uniquely an American problem, and it calls for a uniquely American, all-of-government, rapid response to deal with this public health crisis. I've seen families grieving at homicide scenes. I have seen family members who have yet to recover from the loss of someone who was killed as a result of gun violence. I have seen systems work together or not work together around this issue. And we don't have to agree on everything, but we do need to agree that human life is inherently valuable and deserves this kind of response. And so just as we saw the response with COVID-19 and other health crises, we are applauding the Attorney General for this advisory and looking for Congress and all of government to respond to this rapidly, appropriately, and to the degree that we experience this issue. The magnitude that we experience this in the U.S., when more than half of U.S. adults have been impacted by gun violence, when it's the leading cause of death for children and adolescents, when people can't sleep at night because they are dealing with the trauma of what they have experienced or witnessed. Less often talked about is the impact and the trauma that it has on the people that are doing the work every day in ERs and on the ground implementing community-based strategies. We need this, and we need it now. So we need additional funding for research. Everything that's called for in this advisory, that means addressing physical and mental health impacts of gun violence. It means completely or continuing to fund community-based strategies like community violence intervention in local communities that we know It works. We know it works. And we know what happens when we have the full backing of the full government to make something work. And so we are just glad, on behalf of the Center for American Progress, we are glad that this advisory happened. We thank you all for your support, for your hard work, and thank you to every survivor that has ever told your story, every survivor that is working on the ground, every survivor that's working in policy, on the Hill, wherever you might be, even if you're sitting at home. Thank you for continuing to tell your story. Thank you for continuing to exist and to give us hope that there is a better future, but we got to put our hands to work to see it.
All right, and with that, we'll open it up for any questions.
So I know oftentimes opponents of tighter gun regulations say things like, guns save lives in self-defense as often as they take life. How do you respond to that?
Well, my response is simple. Number one, this starts with the false notion that our movement is looking to disarm every American of every gun they have in the entire country. And it's just not true, right? What we're fighting for is common sense gun reform. What we're fighting for is resources for our community to stop this violence before it happens. And what we're fighting for are conditions in this country where people don't feel the need to use guns to solve their problem. And so we don't contend that, yes, I'm sure there are lives that can be saved due to guns. But when you look at the statistics, having a gun in your house makes you more likely to be shot by a gun, including the children that live in your home. These are decisions each American has to make for themselves. But the thing about this announcement is it really focuses us in on the science and the data, and it tells a story. And the story it tells is the more guns we have in this society, the less safe we are.
Do you anticipate that this announcement is going to change the rhetoric in the Republican Congress at all?
Well, my hope is that it does. I mean, I think after every mass shooting, we always say, this is the one, this is the one. And my Republican colleagues tend to, a lot of times it isn't the one. My hope is that they'll be able to read through this. It's a nonpartisan report that comes from a place of data and science, and my hope is it'll push them in the right place. We are seeing some progress, though. When the Office of Gun Violence, when Marjorie Taylor Greene put an amendment on the House floor to defund the Office of Gun Violence Prevention, I had conversations with several of my Republican colleagues about it. And at the end of the day, not only was the office saved, but it was saved by 7 Republican votes, which, if you know anything about this Congress, is a big deal. And so when I spoke with them about why they voted to save the office, they said it's because of the evidence-based solutions they've seen take place even in their own districts post these shootings and before it, which leads me to believe that if we focus on the science and the data of this, I think there are some hearts and minds we can change on the Republican side to actually get things like universal background checks passed. All right. Thank you all for being here. Woo! Thank you. Appreciate it. Should we get a photo, Sam?
Yeah, let's get a photo.
Okay.
Of course. If y'all don't mind. You can just gather.
Thanks for being out here. I
everyone.
know it's hot. Okay. You're welcome.
Maybe y'all want to step a little bit away from the podium so it's not in the way.
Yeah, maybe just back up a tiny bit. Get everybody in.